See, chapter 7. So we all know what seizures are, right? Seizures are abrupt, abnormal, excessive, uncontrolled electrical discharges of neurons within the brain. It can cause alterations in the level of consciousness and or changes in motor and sensory ability and or behavior. Epilepsy is a term used to define chronic, recurring, abnormal brain electrical activity resulting in 2 or more seizures. Seizures resulting from identifiable causes, like a substance withdrawal or fever, are not considered epilepsy. International League Against Epilepsy uses 3 broad categories to describe seizures: generalized, focal, unknown. So, what this is saying in short is that a seizure is one, right? Like that episode. Right? You're having too much neurons firing off electrical activity, and this causes then the brain to go haywire and or your behavior. Now, if you should have 2 or more that are recurring, 2 or more, then this is epilepsy. However, if this recurring seizure is from withdrawal or substances, like you're taking something or withdrawing from that substance, this does not equal epilepsy. Because we know what's causing it: doing drugs. It's all fun until the heart failure.
That's just the seizure for the withdrawal substance. If it's because of that, that's just a seizure.
Right.
Just because of anything else.
So they are seizures, you're just not having epilepsy. So let's give an example of this. Alcoholism, as much fun as it is, if you drink very frequently and religiously, which you say you don't, but you do, and then you stop suddenly, what will happen? What's the worst? You will withdraw. And if it's severe enough, you can have seizures. Now, if you have seizures, let's say you have 1 seizure, 2 seizure, 3 seizure, but you're withdrawing from alcohol, they're not going to be like, oh yeah, he has epilepsy. You're having seizures from the withdrawal. Even though you're having multiple, it's from the withdrawal. And if you recall back to term 3, that's the biggest thing with alcohol withdrawal. You're essentially just trying to prevent them from having seizures until they fully withdraw.
How close do you have to be to?
I think it's in your life. It's not even like 6 months, a year, or 3. It's like if you had one at 5 years old, and then you're 12, 13 years old, you had another seizure. If you kept track, they might say you have epilepsy. Granted, you're having one every few years, but the fact that it's recurring, something could possibly, it's worth the track of it. You're at risk for it. Like, again, most people don't have even one seizure in their lifetime. Okay, so are we sure about this?
With epilepsy, you can also have more than one in like that time frame that you have.
Right. So epilepsy, that's what I'm saying. Epilepsy is just defined as you've had 2 or more. Now, do some people have seizures every other day? Yeah. Like, and then they try to control it, by sedatives, antiepileptics, whatever the case is. So you can have frequent, have infrequent, that's why it's just 2 or more. This is something that's gonna recur. Okay? Good? All right. Risk factors. So what can lead to this? Risk factors. 1, and the highest probably is genetics. Genetic predisposition, head trauma, cerebral edema closely behind these. Like, swelling of the brain, too much fluid. This usually results right from a low sodium level. A big one that you should know and comes up on tests, abrupt, they say abrupt cessation. Wait, cessation. Of anti-epileptic drugs, meaning you suddenly stop taking your seizure medication. You're taking phenytoin, levetiracetam, or barbiturates, and you suddenly stop taking it, then you're no longer suppressing that activity, and then you can just move. Okay? Infections, metabolic disorders, toxins, these are all just kind of like additional. You should be familiar with the list, but these four right here are, especially these three as other causes, these are the most significant. Head trauma, edema, electrolyte imbalance, so say fluid and electrolyte imbalance or hypoxia. Hypoxia, or getting suffocated, and near drowning experiences, locked in a car. When they're less than 3 years old, like 4 2? Well, at least I let you know that when kids 3, I can let them run a fever. Tough it out, dude. Then I have to wait till 4. Just kidding.
Okay, don't have kids. He's not gonna have kids.
Oh, my Lord.
Raise your hand if you've had kids.
Have?
If you have.
Had?
If you had, you got sick of it. Raise it high, be proud, be proud. Okay. Now keep your hand up if you have ever ridden in a car with them without a car seat under 5 years old. Don't talk anything about my fever.
Don't talk about my
Kid should be there till he's 9 and you were riding with him under 5 in that car? I don't know, man. Child services. I got no car seats around here. She said no, but flash out home. Okay, acute withdrawal, stroke, suffering a stroke can lead to this too. And then we went over the acute febrile state, which means they have a high fever very suddenly, and this is particularly dangerous for less than 2 years old. Tumors, drugs. Okay. Common triggering factors for seizures, again, excessive stress, hyperventilating, acute alcohol ingestion, caffeine, exposure to bright lights, substances like cocaine, aerosols, and inhaled flu.
I just saw something in Colombia.
What?
They like inhale glue, like.
Thing right here in middle school. Right?
Yes, middle school, like,
Where were you?
I like that. I would be doing aerosol.
That's so cute, guys.
covered in a sweet guy. Or, no, then,
I can tell if you've been a sniffer, I just look at your levels. If you're successful, you know, you lost a few brain cells. That's an insult. You guys ever heard that to people? You were a marker sniffer, huh? Like that means you're a little slow now. Like, all right. Now, let's point out this: generalized seizures. Okay, so. Generalized seizures. This means they involve what? Both hemispheres of the brain. Generalized seizures can begin with an aura. And we'll go over what an aura is. Which is, it defines it there already. An alteration in vision, smell, hearing, or emotional feeling. I'm gonna put here in parentheses like a warning sign, and then we'll put that it's a sensory alteration because it affects one of your 5 senses. Okay. Clients can experience 5 types of generalized seizures. We're gonna go over the 5, some of these types. Maybe not all 5. But let's stop right there real quick. So generalized seizures can affect the whole brain, like both hemispheres of the brain. And I put there that they usually begin with an aura. And it's hard to sometimes get the concept across, but so an aura is they're experiencing like a sensory alteration. They either taste, see, feel, hear, smell something different. That's obviously not here. Okay? And that sensory change should let you know that something's not really happening well, and it usually happens right before a seizure. Yes.
I had a friend, she tastes like a mouth full of blood before it happens.
See? People can do that. Have you guys seen The Sopranos? I think that example is a very famous show, and you'll see that when they're playing with Carmine on the golf, they're golfing before he seizes. He starts telling them, he's like about to hit it. He's like, do you guys smell that? He's like, something's burning. And they were casually talking to the side, so they're like, what? And they're like, something's burning. He's like, no, nothing's burning. He's like, okay. And he continues, and he's about to hit it again. He's like, something is burning. They're like, no, right? And he hits the ball, and they're about to walk, and then he starts seizing. And that was his aura, like he was smelling a burnt smell. He was describing like a burnt smell. So they feel it's a warning sign. This usually happens as a warning sign. It's not a warning, but the fact that it's happening is like that alteration already beginning to happen. Does that make sense?
So like a precursor.
Exactly. That's why it's called like a warning sign. And people who are epileptic and they already know, they know when they feel or smell or do that, they already know to get ready. Like they're gonna see. Does that make sense? Yeah. Not that I don't think a service dog can't smell it or say not that they're doing that, but if you guys have ever had dogs, you realize that dogs can read you just by your emotional behavioral cue. So for example, if you're very angry, the dog is angry too. But also if you're having a panic attack or you get really high anxiety, they get anxious with you. They try to be on you. It's because they're so good at picking up on that behavioral cue. Yes.
The dog's able to actually smell what she said about the smell. They say they're able to smell the reaction of the brain, and that's how they react. Same with
Same. But yeah, there are service dogs for a season. They help put you on their side and
they lay on the arms and the legs. They don't
to protect you. Yeah. Pretty cool. All right. So first type. Tonic-clonic, also known as your grand mal. Grand mal seizures. So, a tonic-clonic begins with a few seconds of a tonic episode The tonic is stiffening. And a clonic episode is the jerking. This is usually for a few seconds. And then this is for minutes. You can suffer cyanosis, incontinence, what's that? They can. Alright. Let me get everybody's attention real quick. So you have no excuse for it. If you are not able to differentiate the seizures, you're gonna have a problem with it. You have to be able to differentiate the seizures, what each one is doing. Tonic clonic, also known as your grand mal. They're called tonic clonic because you suffer a tonic episode and a clonic episode. The stiffening of the muscles, they go stiff. That's usually when they fall, right? You see that they're like just like kind of like contracted, and then they have a clonic episode, which is when they start like really like jerking, right? They start like maneuvering, or like it's like a bunch of spasms. Okay, so that's why it's very dangerous. And a lot of them, people that have epilepsy, can wear like helmets or things like that, because when they stiffen up, they usually fall, and then that fall alone will break arms, batter their head trauma, injury from the fall itself. So make sure you have your safety precautions. Now, then if you continue reading, you have two other types of seizures, which are just tonic or just clonic. Now in tonic, knowing that one of them is the mixture of the other, tonic, it says only the tonic phase is experienced. Clients suddenly lose consciousness and experience increased muscle tone. So again, they stiffen up. They just get contracted. And because of this, right, they can have apnea, vomiting, incontinence. They usually last less than 30 seconds, but some can last up to minutes. You just contract and just, there they go, stiffen up, stay in that clonic phase, like stuck. The clonic is the opposite, right, where again, only the clonic phase is experienced. The seizure lasts several minutes. During this type of seizure, the muscles contract and relax. Again, a spasming motion, that's why it's the jerk, okay? Now, the next one is myoclonic. Defined by brief jerky and stiffening of the extremities, which can be symmetrical or asymmetrical. So it is, again, being that it's clonic, more affecting the muscles, it's a jerky movement too. But can be symmetrical or asymmetrical. Atonic or akinetic, right? This is characterized by few seconds of muscle tone loss, meaning they go flaccid. Okay? And it's followed by confusion. So in this sense, if you lose muscle tone rather than stiffening up, you just collapse. Basically like you collapse, you're fainting. But you're not fainting, you're having a seizure.
They're awake with like basically like
right. Huh? I don't know what that is. Oh yeah, I get that, but I don't know what defines it. Maybe. But I think the defining feature would be, and hence the EEG, are you having a seizure? Or is the brainwave pattern different when you're having what you're describing? So the EEG is the purpose of it is to try to determine what's causing the reaction. So hence, when people are like, well, the bright lights are gonna, and they might have a seizure. So good. Then they'll know you're having a seizure. Because then the other one, which is this one, the absence. Loss of consciousness, 10 to 30 seconds. Seconds. 10 to 30 seconds for the absence. No motor activity or even blinking may occur several hundred times daily. Okay. Now, absent seizures, they're
That's
basically just
absence.
going blank, like they just like,
Yeah, that's
they space out, yeah.
Oh, like that, politician.
Like what? Oh.
The one who's like face looks like it's melting.
Now, it says rare in adults, and they typically stop during adolescence. They used to say this here, but they can't recall. So people, I used to joke with people used to be like, oh, like they start talking immediately, like maybe I'm having seizures, you know, like I like space out, and it's like, how do you know you're not daydreaming? They would say, right, or is that? And I'm like, well, you just told me. I said, do you know you're daydreaming? And they're like, yeah. And I'm like, so you're not having a seizure because like you know you're daydreaming. Like these people don't know that they blanked out like that. Like to them it was like I'm talking to you, and then I just resumed talking to you. I didn't notice that I spaced out for that time there. They really don't recall or can tell. Yes.
Is the myoclonic onset symmetrical or asymmetrical? Is that the body or the seizure in the brain?
The body.
So it would be still the whole brain, but only half.
Right.
So it's not like the.
Right. What was more local? All right. So, diagnostics. How we diagnose? EEG is the better one, but MRI, CT. Why are we doing this? Well, the EEG can read the brainwave patterns, but CT, MRI, and cerebrospinal fluid will try to rule out anything else. So you maybe don't, maybe you have a tumor, infection, a lesion, trauma that's causing these things. Make sense? And then comes the most important part. So seizures, you just have to be able to identify that, which kind, understand what an aura is, and you should be able to know when an aura is happening, like what the patient is describing. And more importantly comes the nursing care. What do we do during a seizure? Okay? During a seizure, protect the client's privacy and the client from injury. Move furniture away. Hold head in your lap if they're on the floor. So protect. What I'm going to do is protect from injury, and you have the specifics there in your book. Protect their privacy. Don't forget the privacy. Position the client to provide a patent airway. What position is this usually? On their side. Patent airway. Put them on the side so that when they have secretions, because they usually drool or can throw up, it won't get caught in their airway because they're to the side and it flows out. So that's what it means by positioning a patent airway to the side. Be prepared to suction oral secretion. Turn the client on the side to decrease the risk of aspiration. Another one that I see on there is loosen restrictive clothing. Loosen restrictive clothing. Do not attempt to restrain the client or insert anything in their jaw or an airway during seizure activity. So do not restrain and do not insert anything in the mouth, including an airway. During the seizure. after the seizure, you can place a oral airway. Now, do not use padded tongue blades. That was a big thing before. You get a padded tongue blade in case they bite down, it's padded. You don't put it in their mouth. Okay, document onset and duration of seizure and findings. So that means how did it start, how long did it last, what kind of seizure they had. So document seizures, what I'm gonna put here. Kind or type, onset, duration, right? And after the seizure, you reorient and stay with the client. Oh, what's it after a seizure? Okay, after a seizure, this is the postictal phase. It's known as postictal. Okay, maintain the client sideline to prevent any aspiration, check vitals, check injuries. Maintain on the side if needed. Okay, perform neuro checks, allow the client to rest, reorient them. And ask the client if they had an aura. And try to determine the seizure, the trigger, sorry. Okay. Medication. Administer AEDs like phenytoin. The initial goal is to control the seizure activities and blood levels might be needed to be taken. Take AEDs, and don't forget that some of these have a blood level, which is more specific to your farm book. Okay? Do not stop taking suddenly. Take at the same time every day. And you gotta check that they don't develop tolerance, which means that over time, the client becomes like less sensitive to the medication. So even though they're taking the same amount, it doesn't no longer have the same effect or the same level in their blood. So you gotta keep on taking levels for them. Make sure that it's still working. Okay? Now, not to all, but frequently, right? They require oral hygiene for a lot of these medications to prevent gum overgrowth. When using phenytoin specifically, avoid oral contraceptives, some birth control that you take in pill, and warfarin. Because they either decrease or increase the effects. And then you have a few like therapeutic procedures, like things that you can do for them. One of them is a vagal nerve stimulator. And we talked about this before, right? Stimulating that vagal nerve. Now, in this case, you do it differently because obviously when having a seizure, none of this will be able to be followed or instructions or what we were describing. For this vagal nerve stimulator, they put a device implanted into the left chest wall and they they connect the electrode to the vagus nerve. So in a person's chest, here, they place it and they connect the little electrode to the vagus nerve. Okay, the little device. And it has a little electrode inside connected to the vagal nerve. This procedure is performed under general anesthesia. The device is then programmed to administer intermittent stimulation of the brain, specific to the client's needs. So every once in a while, it'll give a little bit